Hello and welcome to Ethics in the News. My name is Hannah Storm and I'm the director of the Ethical Journalism Network. In this episode, I'm speaking with Aida Al-Kaisy. She's a programme consultant for the Ethical Journalism Network, specialising in the Middle East and North Africa, and more recently in Central Eastern Europe. Aida's PhD research examines the practices of the Iraqi broadcast media during the country's conflict with ISIS, and she's also an expert in the media industry in Iraq. I began by asking her if disinformation in Iraq was a new thing.
Disinformation in Iraq is not a new thing at all. It dates back to the Ba'athist regime of Saddam Hussein, where the media was really used as a tool by the government for propaganda and in support of the Ba'athist government. This has been perpetuated since 2003. We saw after the invasion of Iraq and the work of the Coalition Provision Authority in developing new structures in Iraq, we also saw them use the media as a means by which to influence public opinion about American presence and actions in Iraq. This happened again in 2014 when ISIS came into Iraq and took over Ninwa and some provinces in the north. Again, the media was used as a tool for propaganda, and fake news proliferated in order to garner support for ISIS, but also to create a sense of fear of their actions in Iraq. So disinformation is something I believe that Iraqi citizens and media audiences are quite familiar with and have become used to seeing in their media and in their social media. And what's happening is we're seeing a lot of actors, therefore, replicate those actions and replicate that disinformation and replicate the use of the media as a tool for disinformation, even now in present-day Iraq.
To what extent is disinformation being used by authorities against the media during the COVID pandemic?
It's been used in a number of different ways. There was a very high-profile case in early April where Reuters published an article which made claims and alleged that the official figures that were being used by the Iraqi government to talk about the number of cases and deaths from COVID-19 in Iraq were actually inaccurate and higher than what was being reported. The report referenced a number of medical professionals, a number of professionals from the Ministry of Health, some political figures, but all anonymously because all staff have been told by the government not to speak to the media about COVID-19. As a result of this report, the Iraqi media regulator, the Communications and Media Commission, suspended Reuters' license to operate in Iraq for 3 months and fined them a huge sum, accusing them of risking public safety and jeopardizing efforts to manage and contain the pandemic in Iraq. There was a huge outcry against this, and in the end, actually, the president of Iraq, Barham al-Saleh, made a strong case for Reuters' license to be issued. But this was really a strong indication of the government trying to control the narrative and even falsify the narrative around COVID-19. There's also been a number of incidences outside of the pandemic, even previous to the pandemic, where we've seen the government trying to control the media and the narrative and facts and accuracy in the media, and have actually shut down a number of outlets who are reporting against the government or producing data that might contradict data that's coming from the Iraqi government.
So what has the response of the media been to the attempts by the government to use disinformation to curtail its ability to get behind the stories?
The media in Iraq is split into two different groups, if you like. There are the mainstream media, who are highly politicized themselves, rely on funding from politicians or political owners or technocrats that are directly linked, or businessmen that are directly linked to political parties. They become part of this problem. They become part of the disinformation and fake news problem in Iraq. They produce content and narratives that support their financial backers and the politicians that are allied to those financial backers. So they're part of this perpetual problem of disinformation that's been ongoing for decades. Then on the other hand, we have a growing group of human rights defenders, activists, independent media producers, journalists, observatories who are actually doing some work to try to combat the fake news and the plethora of fake content that's circulating in the Iraqi media. They're creating WhatsApp groups that allow them to share video content or articles or quotes and verify the accuracy of that content. They are starting to do media monitoring and content analysis that again allow them to pinpoint where disinformation trends are happening and how they might be able to avoid them. And I think that's very interesting in the case of Iraq, because networks in Iraq is a new thing, and working together in a networked way is a new phenomena, but is actually quite successful currently in a very small percentage of the media.
Can you give me any examples in terms of what good practice looks like, or what some of the solutions that have been come up with, what they look like?
So one of the big trends in disinformation in Iraq at the moment has been an increase in the use of deep fakes and artificially created video content. This has been ongoing for a couple of years. In the Iraqi election campaign in 2018, 2 years ago, for example, a number of sex tape videos were circulated on social media, which were used to discredit female candidates in the election. And actually, as a result, a lot of female candidates did actually stand back. So it worked in a sense of fake content having a huge impact on the political landscape in Iraq. This trend of deep fakes has been seen in the protest movement, where videos have been created that are associated with the various militias that are operating in Iraq, which show fake content of protesters killing security forces or militia officials or policemen, for example, which again are being used to discredit protesters and the protest movement. In the WhatsApp groups, and the WhatsApp groups are quite large, actually. So the one particular WhatsApp group that I'm familiar with, they would share this content within the group and ask for someone to verify the content. If no one can verify the content, it's not being used. If someone can verify the content and say, yes, it's true, they then ask for the contact details of the person in the content in order to ensure that they can verify it directly with the source where possible. In some media platforms now, they are being very transparent about whether or not this content has been verified or not. So even if they use the content, they're clear with their audiences as to whether or not it's been verified. Again, I must stress this is in a very small number and percentage of media platforms and within a small minority of journalists, but it is happening and it is starting to have an impact on content that we're seeing in the Iraqi media.
In terms of the content that is being shared around COVID-19, have you seen any situations where the situation has been made worse by a lack of accountability, a lack of media holding those in power to account because of COVID-19?
I think it's a very complex situation in Iraq where the media community and journalists are torn between holding government to account or holding officials to account and also supporting the national interest. Iraq has been through war, conflict, health crises in their own right. Epidemics, cholera, etc., are all part of daily life in Iraq and have been for a very long time, a number of years. So it's a very difficult decision, I think, for an Iraqi journalist to make as to where and how they should be calling governments to account. Having said that, again, in the WhatsApp groups, and I'm noticing this is now translating into media content, they are now sharing amongst themselves official figures from both the Ministry of Health and hospitals on the number of cases and the number of deaths around COVID-19 and what that means in terms of reporting accurately. There's also been a lot more work tackling some of the socio-political or socio-cultural aspects of COVID-19 in Iraq. There have been a number of articles looking at and exploring religious attitudes towards hospitals and the medical profession, which are also shaping the Iraqi response to dealing with the pandemic.
So you touched on this idea that there are significant stigmas around access to medical help and support, and that there are different types of authorities from whom people in the public get their information. We have recently pulled together a tip sheet at the Ethical Journalism Network for journalists, which touches on some of those areas. Can you explain what that looks like in the Iraqi context?
So we've talked about the issues of accuracy and the importance of accuracy, and I think that's something that is being tackled by the Iraqi media, which is very important. But one particular area that stands out in the case of Iraq is this notion of combating hate speech or social stigmatization of people who might be carriers of COVID-19 or exhibiting symptoms of COVID-19. Where this becomes problematic in Iraq, in a very traditional country that is governed by traditional attitudes and tribal, in some cases, reactions to medical issues, which is also further amplified by the fact that a lot of the Iraqi population feel untrusting of the Ministry of Health and the medical profession because they associate them with the politicization of the government. So a really important element that the media really need to consider when covering COVID-19 in Iraq is how they tackle this issue of social stigmatization. There was a really interesting report produced by the Iraqi Media House in Iraq, a NGO and research body that produces a number of different pieces of content analysis and media monitoring on the Iraqi media, that looked at the politicization of the pandemic in the Iraqi media and how that linked back to this issue of media financing by politicians and media capture by a number of political supporters and allies of the government. So in terms of the 7-point test, I think really one of the most important elements is the point that allows journalists to reflect on how they might tackle issues of social stigmatization and hate speech towards carriers and symptom showers of COVID-19.
And that was Aida Al-Kaisy speaking with me there for our latest edition of Ethics in the News.